Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's discuss about the heart failure. Here we're going to look at the heart failure and how to treat it. So we are going to break it down into, first we are going to look at the mechanism of action, how to go about the heart failure. Then we look at the pharmacotherapy, that is we'll be discussing some important drugs which are required for this, and we'll be adding a note. Then an important concept, that is a Fantastic Four, we'll be discussing that. Then moving on, we also talk about the refractory heart failure. So what is the refractory heart failure? And the next concept will be the treating the refractory heart failure. So this is what we are going to look at in this video. Next, so first up we have the mechanism of heart failure. So what is the mechanism? So mechanism is by blockage. So what do you block? First is the sympathetic pathway. Next will be the RAS. Third will be the degradation of the natriuretic peptide, that is the neprilysin inhibitor. Now let's look at the pharmacotherapy. So under this pharmacotherapy, there is first one is the beta blocker. So this beta blocker, there is what it does, it blocks the sympathetic system, and the commonly used drugs, it includes the metoprolol, the bisoprolol, as well as the carvedilol. Next is the bisoprolol is the most preferred. Then moving on, we have the AC and the ARBs. The AC inhibitors and the ARBs, they are the class effect, that is any drug from these groups, they are effective. Any drug is effective, and commonly used is ramipril is one of the most commonly used drugs, and the preference will be ACE over the ARBs. And the ACE inhibitors, what it does is it increases the bradykinin. So ACE, it also increases the bradykinin. Next we move on to the ARNI. So what is meant by the ARNI? So ARNI is nothing but the angiotensin receptor blockers along with the neprilysin inhibitors. So this is ARNI. So the first is we have the valsartan. The valsartan being a part of the ARB. Next we have the sacubitril. Sacubitril is nothing but the part of the neprilysin inhibitor. So what this valsartan does is it inhibits the angiotensin 2. Next, the sacubitril, what it does is it prevents the degradation of the natriuretic peptide and the angiotensin 2. So prevents degradation of the natriuretic peptide along with the angiotensin 2. So what is the primary management of the patients in all patients of heart failure? So what you do first is, for all patients with heart failure, you administer ARNIs. So what you do is ARNIs, as we discussed, it is the angiotensin receptor blocker with the neprilysin inhibitors. So along with this, you also do the beta blocker. So these two are the combination drugs in primary management. So now let's look at some specific conditions. So in case the preferential order is ARNI greater than the beta blocker, greater than that of the ACE, greater than that of the ARBs. The next is in case the patient is not euvolumic. So in case the patient is not euvolumic. So in such cases, the first what needs to be done is administer of diuretics. So diuretics is done, and after the diuretics, it is mainly given for the treatment of the congestion, and then only you can start beta blockers. So then you go with beta blockers. So this is done because it can lead to the pulmonary edema. So this can cause the pulmonary edema. That is the reason. Next, moving on, we look at a condition where the heart failure can present with the renal failure. So what do we do in such conditions? The heart failure along with that of the renal failure. So in such cases, the drug which is to be administered is nothing but the hydralazine. So you have the hydralazine along with the nitrate. So hydralazine along with the nitrate is the drug which is administered. Now let's look at the concept of the Fantastic Four. So why is it known as Fantastic Four? Because they increase the lifespan. So that has the mortality benefits. So these drugs include the ARNIs, the beta blockers, the aldosterone antagonist, as well as the SGLT2 inhibitors. So ARNI, beta blockers, aldosterone antagonists, SGLT2 inhibitors. So SGLT2 inhibitors, it includes the empagliflozin as well as the dapagliflozin. So they are known as the Fantastic Four because the mortality is reduced. It has benefits of mortality benefits. Next, the concept of, as we told earlier, the refractory heart failure. So what is meant by the refractory heart failure? This is when the maximum tolerated dose of beta blocker. So be a maximum tolerated dose of beta blocker plus the Fantastic Four. So what is a Fantastic Four? It is a ARNI, the beta blockers, the aldosterone antagonist, as well as SGLT2 inhibitors. So all these Fantastic Four. So you add both of them, and if the heart rate is greater than 70, upon adding the heart rate, if it is greater than 70 per minute, you give the ivabradine, you move on to the ivabradine. So ivabradine is nothing but it is a funny current, and the side effects being the visual disturbance. So yeah, the visual disturbance which is seen in case of the ivabradine. It is a funny channel inhibitor. It is funny channel inhibitor. And in case the patient is still symptomatic, so you have symptoms. So you're telling the symptoms are still present, and then you give the refractory heart, then you call it the refractory heart failure. Now, we move on to the treatment. Moving on the treatment of the refractory heart failure, we have the treatment of the refractory heart failure. The first one is in case of the white QRS or with the normal QRS. So in case of the white QRS, you go for the cardiac resynchronization therapy, and next you also move on to the cardiac transplant. So cardiac resynchronization therapy is what you go for, and then you also can go for the cardiac transplant. So this is in terms of the white QRS. Next, in case you have a presence of the normal QRS, so what to do? So in such cases, the LV assisted devices or the ICDs. The ICD stands for the implantable cardioverter defibrillator. So this can be used. So this was all about the treatment of the heart failure. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.